Trigger warning. This podcast episode discusses eating disorders and may be distressing for some listeners. For support, call Butterfly Foundation's National Helpline on 1-800-ED-HOPE. Chat online or email support@butterfly.org.au 7 days a week, 8 a.m. till midnight.
The content provided in this podcast is for informational purposes only and is not intended for a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your doctor or other qualified health professionals with any questions you may have regarding your medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. On today's episode, we will be bringing awareness to eating disorders and type 1 diabetes with clinical psychologist and Butterfly Foundation's National Helpline Manager, Sarah Cox. We're your hosts, Isabella and Sebastian Harris. This is Life on the Level. If you're listening, you probably have or know someone with type 1 diabetes. We're here to give you the knowledge and encouragement so you can thrive. Join us as we dive into all things type 1, real experiences, expert insights, and practical strategies. So I personally have struggled with eating and my body image, as I feel many females and males, but statistics mainly show that this is females that have this issue. And those thoughts around my body were definitely exacerbated when I was diagnosed with diabetes.
Yeah.
So when I was diagnosed, I was commended on my weight loss, which wasn't intentional at all. I was incredibly sick.
Yeah.
And as someone who was dealing with all those sort of preteen dramas everyone else has at 11 years old, and then also recently being diagnosed with a chronic illness that I personally was having a really hard time to accept, I feel that that impacted the extent that I focused on food and my body image concerns quite dramatically.
Eating disorders are a serious mental illness that can be complicated to understand and to open up about. So today we're going to be talking to an expert about it. Welcoming Sarah Cox, clinical psychologist and Butterfly Foundation's National Helpline Manager. Hello Sarah, how are you going today?
Yeah, good, thanks.
Given that only 11% of Australians are confident in recognising signs of an eating disorder, can you describe some of the common signs people should be aware of when it comes to that, particularly with those with diabetes?
Yeah, definitely. Look, there are some common signs of an eating disorder, and that includes things like body dissatisfaction, and then it also includes any sort of changes in behaviour or fears or preoccupation around things like food or eating, and also body shape, weight and size. So for somebody with diabetes, that could look like extreme weight changes. So that can be weight loss or weight gain. It might be less attention to their diabetes management, especially in the context of food or eating. It might be increased secrecy around their diabetes and food intake. They could be having some concerns around the impact of insulin on their body weight, as well as possible misuse of insulin. And you might notice them restricting either food groups or their overall food intake, as well as maybe extreme methods around weight management. And I think in the context of diabetes, it's really important to note that a lot of these behaviours can lead to extreme and dangerous fluctuations in blood glucose levels, as well as risk of diabetic ketoacidosis.
Wow, okay, so you already answered my first and my follow-up question. That makes that a hell of a lot easier.
Oh, great.
What is the best way to approach and support someone, whether they have type 1 diabetes or not, if you're concerned they might be struggling with eating concerns or body dysmorphia or anything like that?
Yeah, look, it is really good to try and share your concerns as soon as possible and try and do it in a really caring and compassionate and non-judgmental way. The evidence does show that seeking support early can help people connect with the right professional care and treatment. And the sooner that happens, that really can help with improved health, recovery process and quality of life outcomes. I think what's also really important for families and friends is to seek information and assistance themselves, so going to reputable and specialised organisation. And that can not only help to identify possible support options, but it can just really help to break down a lot of the fear, the stigma and shame that can also be barriers to people getting support.
Are there any specific phrases or actions that people should avoid that might cause harm to someone that they're concerned about with these issues?
Yeah, look, it is important to know that eating disorders, they are serious mental illnesses and they do have potentially fatal consequences. So it's really important that we never trivialize it, never suggest that it's a lifestyle choice or that people, should snap out of it or can. And also just knowing that anyone can experience an eating disorder and you really can't tell by looking at somebody, regardless of somebody's shape or size or weight, including people who are living in larger bodies. It's really important that we don't make assumptions or invalidate their experience based on their physical appearance. I think as well, it is complicated in the context of diabetes and eating disorders, but it can be harmful to have that over focus on food and weight. So as much as we can, really trying to avoid weight stigma, really focusing on looking at healthy eating and healthy behaviours as opposed to strict dieting or weight loss.
Yeah, I think it's quite hard when, the whole illness is focused on your food intake and the type of foods that you're eating and the amount and stuff like that.
It is incredibly complicated.
Yeah, you just get extremely paranoid about it. Like it's this kind of thing that's on your shoulder where you feel like you have to do something about it.
And it has to be perfect as well, or, you're causing damage to your body.
Yeah, and the way they kind of set up, I know, at least in some of my experiences, it's kind of like this thing where it's like you have to do this, it has to be right, and you just go, well, like it's not a perfect thing, and most of it you can't really see anyway. So I can understand that whole stigma thing, and particularly Sarah with stuff you were saying. So you were briefly talking about what it was like to get it known and to get some help and stuff like that to bring to your attention really early. So kind of what are the types of therapy that are beneficial for people with eating disorders? And is there ones that are particularly more beneficial for those with type 1 diabetes, say, compared to others?
Yeah, look, it's a really good question. For anyone with an eating disorder, a multidisciplinary care team is really important. So that might include a GP as well as mental health professionals. For somebody with diabetes as well, that multidisciplinary care team just becomes so critical to make sure that the diabetes as well as the eating disorder is being appropriately managed. So that means making sure that a dietitian is included and other health professionals as well. There are lots of evidence-based treatment options available. And look, the best fit is usually it's around things like the person's age, their preferences as well, what eating disorder diagnosis they might have, and also what other sorts of treatments they might have tried or found effective in the past. But some of the common ones for adults that tend to be most effective would be things like cognitive behaviour therapy, interpersonal psychotherapy, or dialectical behaviour therapy. But they do need to be tailored to the eating disorder. And for people who are under 18, usually a family-based approach tends to be most effective.
So pretty much there is no quick fix. It's not like something that magically disappears or anything like that.
No, and I guess that links back to, eating disorders just being really complex and severe mental illnesses, and really does take that whole of team approach, particularly with that added complexity of diabetes in there.
With less than 1 in 3 people reaching out for help, why do you think individuals with eating disorders, specifically those with type 1 diabetes, struggle or hesitate to ask for the help that they need?
Yeah, look, it's a really big question. I think that there's so many stereotypes and misconceptions around eating disorders, and that can contribute to a lot of stigma and shame can prevent people from getting help. I think as well, eating disorders, they tend to involve a lot of secrecy, and so sometimes the person impacted or their loved ones may not even realise what's happening. And we also know that shame really thrives in secrecy, and so that can then further prevent people getting support. Eating disorders as well, there's a lot of really extreme fears around weight and food and eating, and so particularly with people with diabetes, they might feel some really intense fears around maybe talking and being given some dietary advice that they really just don't want to follow.
So you've got an invisible illness and then you're secretly hiding another disorder that you're dealing with, right?
Exactly.
Good. That's great.
You can understand the complexity and the challenge,
Very complex, yeah. What steps can be taken to encourage more people to seek help earlier or when they need it?
Yeah, I think the more we can work on prevention and education as early as possible, that helps with just community awareness, helps people understand the realities, which can break down stigma and shame. I think it's also eating disorders can affect anybody. And so making sure that we don't dismiss somebody's concerns just because they're not fitting a particular stereotype that we might hold. I think it's also really important, particularly in the context of diabetes, that healthcare professionals are aware of this intersection between diabetes and eating disorders. And in fact, people with diabetes are at greater risk of an eating disorder. So just having health professionals doing early screening as much as possible and then really trying to help people get that early intervention.
So I know that you talked a lot about stigma, and I realise that it's a very colossal thing, and there's not really something that is like, yeah, if we just talk about it a bit more, it's going to solve things. I know that it's a lot more complex than that, but it's just, how can we, whether it be as individuals or people with family or stuff like we're around people with diabetes, how are some ways that we can help remove that stigma, particularly to do with the physical appearance and the eating disorders among individuals with type 1 individually?
Yeah, so the more we can educate ourselves with accurate and factual information, and the more we can have open conversations and share the knowledge we might have, so just helping to really spread that awareness that eating disorders do not discriminate. They can impact anyone, regardless of age or gender, body shape or size, including people living in larger bodies. So just really helping break down that stigma that there's a really narrow group of people who might be prone to an eating disorder. And I think as well, just knowing that there's lots of different types of eating disorders and they can look very differently. So again, that can just help us to move away from stereotypes and break down the stigma there. I think the media can play an important role. So making sure that, we're portraying diverse experience of eating disorders. And if there is sort of, in the context of diabetes, if there is health campaigns or information being prepared, just making sure that it does take into account as much as possible, trying to avoid weight stigma and really trying to focus on, health as opposed to weight.
Yeah, so you mentioned a bit about the media and the idea of how that's kind of changed over time. What do you think the big role that particularly that I've seen, I'm sure Isabella's the same here, is what kind of role has social media played in this idea of eating disorders?
Yeah, look, that's a really big question. Definitely we know that media and particularly social media really has perpetuated a lot of this, the thin ideal and a lot of myths around beauty and what's realistic. We know a lot of social media has filtering and editing and things like that. So I think it really has contributed to just some of those really unrealistic expectations that people then put themselves under as far as what they can achieve regarding the size and shape of their body.
You can't really get rid of social media in our day and age. How can people sort of turn that more into a positive for them and a positive experience, and that they're not triggered as easily by these sorts of outlets?
Yeah, it is a great point, because I guess, nothing's inherently good or bad. There can be some positives about social media and connection, and, there can be access to accurate information and kind of supportive communities. So I think it's around doing a bit of filtering of the information you are consuming. So being quite mindful of potentially toxic and harmful maybe posts, or and maybe trying to reduce your exposure to some of that harmful and unrealistic and toxic messaging, consciously choosing to engage with and follow, more healthy and realistic representations of beauty, having a lot of diversity of what you're consuming as well can be helpful. And being mindful of what you're posting as well. So being really aware of just trying to present a realistic representation of yourself and trying not to buy in and perpetuate, I guess, those toxic, realistic ideals that can be out there in social media.
So avoid filtering your face and your body, or sucking in your stomach, or
Look, to an extent, I guess, trying to have a bit of balance with it, I suppose, and being educated, knowing that, okay, you might be seeing that, but that person probably is sucking in their stomach and might have a filter on, and just knowing that that's not necessarily how that person is going to look in real life in front of you, and that's okay.
I think being aware that social media is the highlights of all the good parts of someone's life, and no one's going to choose to show the bad parts and the struggles and the stuff that they're going through. I know that some people do, and that's great. I think that's great. But I think a lot of social media is just all the good parts, and people get stuck on that. And then they go, that's their life. That's who they are. Why aren't I happy all the time? Or why don't I look like that all the time? And it can be quite consuming.
That's right. I guess that's a great point then around just media literacy, just, knowing, not arming yourself with that knowledge that that's not a realistic portrayal. People are presenting a really narrow snapshot, and, we've all got ups and downs, and we've all got times where we're not looking or feeling our best, and that's part of being human as well.
As a clinical psychologist and someone on the National Helpline, I was kind of wondering, what is the one big question that you get asked about eating disorders? First one, what's the question you get asked the most? And kind of secondly, what's your best advice for someone who wants to help out a friend or someone that they know that's struggling with something like this?
Yeah, look, that's a really good question. I think probably really commonly we just get people come to us for all different kinds of support, which is, we feel grateful to be able to provide that. I think what can be really common is just people feeling really unsure and overwhelmed by what's happening, whether it's something that they're experiencing themselves or whether it is a loved one that they care about, just that sense of not really knowing what's actually happening and not knowing what to do or where to go. I think that can create a lot of anxiety and feel really overwhelming. I guess that's where we can play a role in just helping to provide that a bit of an expert and objective lens on what might be happening and help guide people in the right direction. Some of our top guidance we like to reinforce to people is that recovery is always possible. It doesn't mean it's easy, and it doesn't mean it's going to be a simple or quick process. No matter where a person is throughout at any point in the experience of an eating disorder, it is always possible to work towards a recovery journey, but definitely getting support as soon as possible, trying to reduce that secrecy, which helps the shame to dissipate a bit as well. Reaching out to trusted support networks, reaching out for professional support, particularly when you've got that intersection of something like diabetes, really engaging a healthcare team who are experts in both eating disorders and diabetes, that multi-pronged approach.
Those who are in the space of diabetes and looking after someone's diabetes, their job is to make sure that they're looking after their levels and that they're healthy. Yeah. And I guess if something like an eating disorder intersects with that, it's quite difficult to have that balance of what you're looking after. Are you trying to treat the eating disorder? Or are you trying to treat diabetes? Because it's quite difficult. So I guess what would you say to health professionals who are dealing with someone who is struggling with both, and how can they sort of level out the care and make sure that they're looking after both aspects?
It's a really important point, and I think it's where there can be sometimes a bit of a tension point when there's a health condition like diabetes and also an eating disorder. I think it's around, again, that idea of a shared care approach. So each professional being informed, focusing on their area of specialisation, but working collaboratively. Because, for example, if a person is in an eating disorder inpatient admission, their nutritional plan, it's going to be really critical that that's aligned with their diabetes management. If we're looking at psychological treatment, if we're doing some cognitive reframing, it's going to be really important that the reality of the diabetes diagnosis is kind of part of those new healthy belief structures that we want to help the person develop. So I think it's that collaborative shared care approach is what's really critical, particularly when you've got an intersection of both of these kinds of conditions.
Yeah, and I guess just not the food, the types of food and things like that. I think it's more insulin emission and having a healthy relationship with insulin as someone with type 1 diabetes. I feel like that's super important part of this sort of healing journey for a lot of people who struggle with an eating disorder who also have type 1 diabetes.
Yeah, absolutely. And that's where I think as best as possible, trying to find a healthcare provider that ideally has some experience in both of those areas and kind of is equipped with some of those knowledge to make sure that both of those lenses are kind of being incorporated.
Cool. Is there anything else you sort of that we haven't tapped on, Sarah, that you wanted to say?
Look, I guess maybe just on that area of insulin, it is probably one thing that can be a bit of a differentiator it's like an extra risk factor, I suppose, that people with diabetes can face if they do have an eating disorder. So again, just the more people can be aware of the importance of appropriate insulin use and the risks associated with kind of insulin misuse, I think that's just something really important for people to be aware of.
I'm learning stuff myself as well. Like even just talking, even though I might not have a particularly prominent idea of the eating disorder kind of things, it's still interesting to kind of educate myself as well. So I'm actually learning quite a lot as well just from talking with you, Sarah.
Yeah, actually, it might be something else maybe interesting to note is, I guess, the fact that there is a higher prevalence of eating disorders for people with diabetes. So it is a bit of a higher risk factor, say, compared to someone without diabetes. And again, it kind of makes sense when, we talked before that part of diabetes management often is around like just really closely monitoring food and a lot of weight checking and a lot of that really hyper focus on food and eating and trying to get it really perfect in a way. Those are a lot of the risk factors for somebody to maybe be vulnerable to an eating disorder. So it does make sense that vulnerability is there.
Thanks so much, Sarah. It's one of those things that is a main takeaway for me is that you're not alone and it's okay to open up about it.
For eating disorder support, call Butterfly Foundation's national helpline at 1-800-ED-HOPE, chat online or email support@butterfly.org.au 7 days a week, 8 a.m. until midnight.
And that's a wrap up on another episode of Life on the Level. As we wrap up another episode of Life on the Level, we want to thank you for being part of the supportive community. Your stories, questions, and just being here fuel our mission to offer meaningful support and education to people living with diabetes. Keep the conversation going, stay connected, and remember, together, we're stronger. Don't forget to follow the show to hear more wherever you listen to your podcasts.
This podcast is brought to you by the National Diabetes Services Scheme. The NDSS is an initiative of the Australian Government and is administered by Diabetes Australia.
Diabetes Australia acknowledges Aboriginal and Torres Strait Islander peoples as the traditional owners and custodians of this country. We pay the utmost respect to them, their cultures, and to their elders, past and present. We extend that respect to the Aboriginal and Torres Strait Islander people here today. Diabetes Australia is committed to improving health outcomes for all Aboriginal and Torres Strait Islander people affected by diabetes and those at risk.
All experiences and opinions described in this podcast are those of each individual guest. Your experience and management may be different.